Hello and Assalamualaikum. My name is Nisa Edina and the topic presentation is about hepatocellular carcinoma. But before we begin, these are the group members. Together, we will explain about these content. Kaida, can you explain to us what HCC actually is and why CT is important in diagnosis?
Sure, Nisa. Hepatocellular carcinoma, or HCC, is the most common primary malignant cancer of the liver. It arises from hepatocytes and accounts for about 75 to 85% of primary liver cancers. Most cases develop in people with chronic liver disease, especially cirrhosis. Risk factors include chronic HBE or HCV infection, alcohol-related liver disease, NAFLD, aflatoxin exposure, and metabolic disorders. CT imaging plays a major role in diagnosing HCC. For classic CT features include the anterior phase hyperenhancement, portal venous washout, and delay capsular enhancement, which help to determine tumor stage and treatment planning. Due to the tumor's characteristic vascular behavior, on contrast enhanced studies, compute tomography CT is an essential imaging modality in the diagnosis and treatment of hepatocellular carcinoma HCC. Hepatocellular carcinoma HCC usually shows arterial phase hyperenhancement followed by portal venous washout and delay capsular enhancement. So these traits allow for a non-invasive diagnosis in a high-risk patients without the need for a biopsy. Additionally, it is necessary for tumor staging because it enables precise the evaluation of the tube number, size, anatomical position, vascular penetration such as portal vein tumor thrombus, lymph node involvement, and extrahepatic dissemination of lesions. So all this information is vital for choosing the best course for treatment. Tasha, will you explain to us why is HCC becoming more common worldwide?
Thank you for the question, my dear friend. So now I'll explain the common sign and symptom of hepatocellular carcinoma. In the early stages, many patients have no obvious symptom, which make early detection difficult. As the tumor grows, the most common symptom is pain on the right upper quadrant of the abdomen, where the liver is located. Patient may also experience abdominal swelling or fullness, unintentional weight loss, and loss of appetite. Other frequent symptoms include fatigue, weakness, and jaundice, which is the yellowing of the skin and eyes due to the liver dysfunction. Some also may develop nausea and vomiting, and in advanced cases, we can palpate a liver mass or fluid in the abdomen known as ascites. Occasionally, patients will also have itchy skin due to the bile accumulation in the body. Overall, these symptoms often appear late in the disease, which is why regular screening and CT imaging are vital for early diagnosis and better outcome. In advanced stages of HCC, the disease can cause several serious complications. Portal hypertension may develop, leading to the enlarged spleen and varices, which can result in gastrointestinal bleeding. Some patients experience sudden abdominal pain if the tumor ruptures, or leg swelling, known as edema. In severe cases, hepatic encephalopathy can occur, causing confusion or drowsiness due to the build-up of the toxins in the brain. These advanced symptoms indicate liver failure or tumor progression, requiring urgent medical attention. So, to build up on this, I would like to ask Ms. Laini on how this HCC typically occur clinically on the patient.
Thank you, Amanda. Okay, so now let's dive into the clinical feature for HCC. So clinically, early HCC is often asymptomatic, which make detection very difficult. As the tumor grows, patient may feel region upper quadrant pain, early satiety, and experience weight loss or hepatomegaly. If the patient has cirrhosis, we often see jaundice, ascites, and varicose hemorrhage. Portal vein invasion can lead to repeat deterioration. Some patients develop paraneoplastic syndrome like hypercalcemia or hypoglycemia when when metastasis occurs, symptoms may appear in the lung or bones. This clinical feature help correlate with imaging finding during diagnosis. So Nisa, to evaluate this feature in details, CT imaging is crucial. Can you explain how the CT protocol is performed for HCC?
Sure, the CT protocol for HCC uses multi-phase liver imaging, which is essential for capturing the vascular behavior of the tumor. So the phases include the non-enhanced phase, which is to assess the baseline density, fat or calcification, and for the arterial phase, the HCC shows intense enhancement because it is supplied by abnormal arteries. And the third one, portal venous phase, the tumor becomes hypodense, showing washout, and the last one, which is the delay phase, we may see capsular enhancement due to fibrosis. Okay, for the hypervascular lesion, HCC brightens in arterial phase. The hypervascular lesion, such as metastasis or cysts, appear darker in later phases. This sequence is actually very critical because timing determines visibility of HCC. So now that we know the protocol, the next step is interpreting the images. Tasha, what are the key imaging findings for HCC?
Thank you. As you can see, this is a normal axial CT image of the liver. The liver has homogeneous density. The hepatic vessels like the portal vein and hepatic vein are clearly seen with no focal lesion are present. This is an abnormal liver shows the hallmark features in HCC. The images are present in these four phases of contrast enhancement CT scan of the liver, highlighting a lesion characterized by a washout appearance, a critical indicator in the diagnosis of hepatocellular carcinoma. First image shows pre-contrast enhancement, arterial phase hyperenhancement, portal venous or delay washout. Finally, the capsule appearance in delay phase shows further washout of the lesion, which appears hypoenhanced when compared to the surrounding liver tissue as indicated by the white dash arrow. In these CT images showing a large HCC invading through diaphragm into lung base. The axial coronal and sagittal views all clearly demonstrate the extent of invasion and the heterogeneous nature of the tumor. Mass effect occurs when large tumors pushes organs like the stomach, gallbladder, or bowel. Tumors in the upper liver may invade the diaphragm, causing pleural effusion. This is a multi-phase contrast-enhanced CT scan that shows invertive invasion of the diaphragm by recurrent HCC. Image A shows the diaphragm appearing normal with no abnormal thickening. Image B to D illustrate the progressive worsening of the condition over sequels follow-ups. Image B reveals the initial localized thickening of the diaphragm. Image C shows an increase in the extent of this thickening with enhancement. Finally, image D demonstrates further progression where the central and left diaphragm show diffuse thickening.
For vascular invasion, the portal vein is the most commonly affected. A tumor thrombus enhances in anterior phase, unlike blunt thrombus. Advanced cases can extend into the hepatic vein and also the IVC. The arterial portal shunt may mimic HCC but can be differentiated by reviewing all phases. So this figure indicates HCC with macrovascular invasion, which can see the portal vein tumor thrombus. These are the images with arrow indicates a well-defined nodule that becomes hyperdense in the arterial phase in image A. While for the relationship to surrounding liver parenchyma, it is visible as nodular, irregular liver surface and heterogeneous appearance. A pseudocapsule can be seen around the tumor in delay phase. This is actually the example of HCC with pseudocapsule appearance. Since the tumor interacts heavily with liver parenchyma, Kaina, can you explain other relationship with liver parenchyma?
Of course, Tasha. As we know, HCC commonly occur in cirrhotic liver, which is appears more nodular and irregular on CT scan. The tumors stand out due to its classic enhancement patterns. They have two important features to look for HCC on CT scan, which is satellite nodules and peritumoral enhancement. For satellite nodules, they are small nodules surrounding the main tumor. So it often indicates intrahepatic spread and suggests more advanced disease. For the peritumoral enhancements, it appears as a bright ring around the tumor in the arterial phase due to the abnormal drainage or microvascular inversions. In later phase like portovenous and delay phase, we may also see enhancing capsule. So, this finding help predict tumor aggressiveness and guide treatment decisions. Okay, the CT image show a case of HCC with satellite mass. The main tumor is located in segment 4 of the liver and appear brighter during the arterial phase because HCC get most of the blood supply from the arterial. Around the main tumor, you can see several smaller nodules. These are called satellite lesions and they show early enhancements. This means the cancer has started to spread locally within the liver. When we look at the portovenous or delay phase, the main tumor becomes darker than the surrounding liver. It's called washout, which is a classic sign of HCC. So the tumor capsule become clear in the delay phase. Okay, these two images show hepatocellular carcinoma with peritumoral enhancements. In image A, we can see the area around the tumor becoming brighter during the arterial phase. This happens because the tumor increase the blood supply around it. This pattern is often seen in HCC and help radiologists identify the tumor more clearly. So in image B, the tumor show ring enhancements where the outer border enhance more than the center. This can indicate microvascular inversions, meaning the cancer may be spreading into a small blood vessel. Both of these enhancement pattern are important signs that help confirm HCC and assess how aggressive the tumor is. So to close our discussion, Hajar, can you summarize the importance of CT in HCC?
Thank you, Kaina. So, in conclusion, hepatocellular carcinoma is a major global health problem and is strongly associated with the chronic liver disease, especially conditions such as hepatitis B, hepatitis C, and also the cirrhosis. So, CT imaging play a critical role in the diagnosis and also assessment of HCC. It helps us to detect the tumor based on its characteristic enhancement pattern, differentiate HCC from the other liver lesion, and also evaluate any mass effect of vascular invasion. So CT also allow us to assess how much the liver parenchyma is involved and provide essential information for accurate staging and also the treatment planning. By understanding these CT features, we can achieve early diagnosis, guide appropriate management, and also ultimate improve outcome for the patient with HCC. Here are references that we use like the journals, clinical articles, and also the imaging source as cited through the discussion. Okay, We hope this presentation has provided a clear understanding of HCC and how imaging contribute to better patient outcome. So that's all from us. Thank you for your attention.